All right, thank you. Hello, welcome to the Tuesday night Q&A. Typically, you're seeing Dr. Stacy. We're kind of the substitutes tonight. I'm Susan Verhulst.
I'm Dr. Don Verhulst.
And it's just great to be with you. We are so excited about Lifewave and the lives that this amazing technology is changing. And the beautiful company, the beautiful heart of David Schmidt and everything that we're a part of. We just couldn't be more thrilled. Dr. Don and I have been in the health and wellness industry for, 30 years for me, but more like 40 years for you, right? And we've he has formulated many supplements and nutraceuticals. Dr. Don is an author. I've got one of his latest books called Do This and Live Healthy, available on Amazon. I'll have to tell you in case you want to check it out. 10 Simple Keys to Live a Really Healthy Lifestyle. And it's a really great book. But you've been doing this for over 40 years now.
Yes, I have. And I've never seen anything quite like this technology. It's nothing short of a paradigm shift. It truly is reverse aging science and the reverse aging science of the future.
Yes.
I didn't think I'd see anything this effective that works, that is completely safe with no side effects.
And you're a medical doctor, so you went to U of M and then Wayne State Medical School, but you have spent your whole career as an author, as a teacher, as a formulator, and even an ordained minister.
Yes.
So spirit, soul, and body, which is really aligns perfectly with the mission of Lifewave of bringing natural health to many. I do want to say tonight that Dr. Don is a medical doctor, but as Dr. Stacy points out, he is not your medical doctor. And we are not here tonight to treat, cure, diagnose, or prevent any sickness or disease. So I know we're going to have a wonderful time of questions and answers, but we're not going to talk about diseases tonight. If you guys have things that you're going through, we talk typically about the body systems and things like that, but we will not be addressing sickness or diseases of any kind. So we have to be sure to put that disclaimer out there. Tonight is for educational purposes only, and we're so glad that you've joined us. We're going to learn a lot and get your questions answered, and we're going to have a wonderful time. Again, I appreciate the heart of this company, and David Schmidt's heart and goal is to reach 1 billion homes, billion with a B. And Dr. Don and I and many of you are here to help him reach that goal. And, you know, the number is exciting, but that just represents the number of people and the number of lives that have been changed. So we're really thrilled about this. And Dr. Don, let's talk now about the science and tech. And I'll just go ahead and let you take it away.
Well, when I first heard about this, Susan, as you know, you were sharing with me about some of our friends who are getting tremendous results with this patch. And that's all I knew about it. And then I saw one, and what is it? You may have not seen it before. It's about the size of a quarter, and it's got some adhesive on the back. You peel it off, you put it on.
Yes.
For 12 hours of activation, take it off for 12 hours of rest and restoration and rejuvenation, so that when you put that patch back on, you get 100% benefit again from it. It's not dangerous to leave it on for 12 hours, but you don't want to lose any of the effectiveness of the.
You muted.
All right, there we go. Thank you.
Were you muted?
We were muted for a second. So
okay.
12 hours.
12 hours on, 12 hours off. So I thought it sounded crazy. It was like, put this sticker on your neck and it'll heal everything, cure everything you have. And I'm like, no, this is not possible. So I went to study it, really to show Susan what was wrong and how there's no science with it, which is what I believed at the time. Instead, I went and saw over 80 clinical studies, which were not even done by Lifewave. They're independent, which is unusual in and of itself, but quite valid. And also double-blind, placebo-controlled, even peer-reviewed, some of them, which is the highest level of scrutiny. So the conclusions of the science are not on trial here. This works, and there's some very solid science behind it. So then I started to look at it more and decided, okay, is it safe? Well, first of all, this patch is non-transdermal. You may have heard of a transdermal patch. Dermal means skin, trans means goes through the skin. And a transdermal patch is like a estrogen patch, a nicotine patch, a smoker's patch, where the chemicals in the patch go into your body and make a difference, which is a fine modality. This is non-transdermal. In other words, the media in the patch is not going, none of the chemicals from the patch are transferred to the body. That's wonderful because it has no chance to interfere with any pharmaceuticals you might be on, over-the-counter medications, nutraceuticals, vitamins, minerals, herbs. So it's completely safe. Well, if nothing's going in your body from the patch, how does it work? That's the next question. And the answer is it uses your body simply as the energy source. The infrared on your body, we all give off infrared constantly. That's why we can see each other with infrared glasses, even if it's pitch dark,
Right.
because we're giving this energy off constantly. It's heat energy in our case. And this is trapped by the patch. And the patch is just a combination of microcrystalline amino acids, organic amino acids, and electrolytes and other ingredients that, when exposed to infrared, create a very specific wavelength of light. And that wavelength of light is reflected in the body. And that's what causes the signaling molecule in the case of the X39 stem cell activating patch. This is GHK copper peptide, stimulates that, and that's very well researched to prove that it will increase stem cell activity in number. So that's how it works. And you say, wow, that's really strange. No, it's not really strange. It's really simple and it's ubiquitous. It's everywhere. Your body's been doing it your whole life. It's the exact same process that happens when sunlight hits your skin and causes your skin to make vitamin D. That's light therapy, photo light, bio, the body, modulation, changing the body with light. It's been happening to you all your life. It's still happening to you. In this case, in the case of stem cells, you used to have full activity when you were born. Then by the time you're 35, you've lost about 50% of that stem cell activity. By the time you're 65, you've lost 90% of that activity. So what's the big deal? Well, a stem cell can become any kind of cell you need. If you're having issues in the cardiovascular system, that can become a heart cell or lining of a blood vessel cell. If you're having problems in your brain, it can become a neuron. In your skin, it can become a skin cell. Whatever your body needs, a stem cell can become that. So it's very important to keep that stem cell activity.
And that's where they come up with the word pluripotent.
Pluripotent means it can become anything.
Okay.
It's a cell that has not differentiated yet. Once a cell becomes something, that's it. It's that kind of cell from then on. Any more divisions will be that same cell, but a stem cell can become anything. And I was a big fan of stem cell therapy, even since I've been 40 years of natural alternatives. But it's limited in its scope. Traditional stem cell therapy, which is simply, to make it simple, is to collecting your own old worn out stem cells and concentrating them and injecting them back in at a place where you're having a problem, save your knees, your hips, your back, whatever it may be. And there's tremendous success at doing that, but you have to have pretty much a localized area, and it's very limited. You can't just inject it into a brain, although they tried and had some issues there. You can't inject it in the heart, certainly, or in the skin. How would you do it? So,
and let's talk about expensive.
Yeah.
Because we've had friends do that. They've gone to Mexico, over 5,000 for each knee. 30,000 in Panama, our friends with the back issue.
Yeah.
And he was still waiting for that to kick in. This was years ago before we knew about the stem cell activation patches.
And now stem cell therapy, traditional, has been made illegal in the United States. So you have to travel out of the country to even get it.
Right.
And it's still a fine modality if there was no such thing as the stem cell activating patch. And that's when this game really changed, is when David Schmidt spent $4 million of his own money and 10 years in research of coming out with this patch a few years ago, which he got a 20-year global patent
Yeah,
on
exciting.
this stem cell activating patch X39,
Mhm.
which is not, they don't just give those away. You've got to have
No,
some solid science. He had to
right.
prove that it was increasing GHK copper peptide, which
Mhm.
then we know enhances stem cell activity.
Well, those were the clinical studies that kind of won you over because I was gun ho. When I heard by age 35, we're down 50% of our stem cell activity. And by the time we're 65, we're down almost 90%. I was like, sign me up. This is something that's going to help me live younger and go into my older years being healthy and pain free. This is awesome. And you did the research. And one of our favorite studies was the one that talks about every 6 weeks on the stem cell activation patch actually reduces the age of your cardiovascular system, your heart, by 8 weeks. Now, that was pretty exciting. And I mean, that you've never seen of anything like that. So this is basically cutting edge. It's definitely ahead of its time. And we're it's like smart technology for your body, wearable light therapy. And David's been inventing patches for about 20 years now, but it was the X39 that really accelerated the growth of this company and the results that people were seeing. So it's pretty exciting. And, no one is without hope. That's what I, that's how I feel about this, don't you? I mean, nobody is without hope anymore. So if you're in a hopeless situation, let's talk. Let's see what we can do to help. Of course, again, we can't make any claims to treat, cure, diagnose, or prevent any sickness or disease, but your body is so fearfully and wonderfully made when you give your body what it needs. Let's see what the body's going to do. So, did you have any more
Yes,
about the
well,
science and tech? And then
yeah,
we'll
well,
start
this
taking
company is
questions.
not the new kid on the block here, and the patches are not on trial.
Mhm.
This science has been around a long time, although David Schmidt is the inventor of the technology. You want to tell them how this company got started, Susan?
Sure. So back in 2000, the government, the Department of Defense, had heard about David and, in a nutshell, had asked him and heard about his technology. Would he be interested in making something to help the Navy SEALs? Because they were on these long submarine trips and they were doing caffeine and amphetamine, and they just needed something to help them and to strengthen them. And David came up with the patch technology, which is our energy enhancer, the very first patch. Well, then, of course, we all know what happened shortly after that, 9/11. And the funding, of course, had to leave that and now go in a different direction. And so David was sitting there with this technology and what to do with it. And that's basically how Lifewave began. He started the company in 2004, and so we are in our 20th anniversary now of Lifewave. And like I've said before, we're all just getting started. We're just beginning to tip the iceberg of all the people we can help with this amazing
There are
technology.
literally thousands of doctors all over the world now
Yes.
using this wearable light therapy.
Hmm.
So it works. There's no question. We know what happens when you put X39 on C7, which is where we recommend you wear it. It'll work anywhere on the body, but the
Hmm.
clinical studies were done for
Or beneath the
X39.
belly button.
Yeah,
That one
in
too.
the C7 area, which is the
Hmm.
bump on the back of your neck. If you feel
Bump your
down the
head.
back of your head,
Hmm.
down to the base of your neck, where your neck hits your body, there's a bigger bump. And it doesn't matter if you hit the exact spot. You can be an inch or two high, low, left, right. Just get that patch on, 12 hours on, 12 hours off.
Hmm.
And that will begin to wake up those stem cell pathways. So
Beautiful.
this technology is phenomenal. It's cutting edge. It's truly a biotech company, and it's the reverse aging science of the future. As
Hmm.
Susan mentioned, I don't know anything else that will reverse the age of your cardiovascular system in six
Hmm.
weeks by 8 weeks. That's turning back the hands of time.
Absolutely. So,
Phenomenal technology.
cellular reverse aging. How do you like that? Have you ever heard of anything that's truly doing this, scientifically proven, with these studies that are double blind, placebo, and many of them peer reviewed, which is really exciting.
Yeah, so it met all of my criterion for for using it with other people and
Hmm.
recommending it, in that it was safe,
Hmm.
being non-transdermal, in that it was effective with all these clinical studies, and
Yeah.
finally even affordable. For less than the price of a cup of some of these coffees out here, you can
Right.
wear the stem cell activating patch and literally change the course of history of your life, adding years to your life and life to your years.
There you go. Well, everybody has their grocery list, and we started out with, for me, shoulder pain, hip pain, foot pain. I work in radio, and my voice was starting to really get taxed and hurt, and my hair was so gray. And I still color my hair, but my hairdresser is amazed at how I've got so much more color coming in. And someone else was just sharing that on the chat. You had hip pain as well. I know you were sleeping kind of funny sometimes, and ended up with prostate getting up in the middle of the night. So you're not getting up in the middle of the night anymore.
Yeah, I didn't notice that at first. In fact, I wore the patch, and this needs to be understood by people.
Yeah.
You can wear the patch many weeks, sometimes many months, and not think anything's happening. It is happening, but you may not feel
Mhm.
it because after 5 weeks, I said to Susan, "This isn't doing anything to me." And she said, "Well, you're not getting up 2 or 3 times a night to go to the restroom and
Because it
waking
was
me up
waking me up.
because you don't miss something like that." And I thought, boy,
No.
that's true. So for over a year now, we've been patching a year and a half almost.
Hmm.
I have
Yeah.
not had to do that. And then I got tremendous energy, not like a caffeine jittery kind of thing, but just like a stamina,
Yes.
a
Yes.
youthful energy that was very significant and marked. I
Hmm.
mean, taking years off, I've done things and
Hmm.
felt like I haven't felt in 20
How about
years.
recovery after exercise? That's
Yeah,
another one that's been amazing. Clearer thinking, wound healing. I had that keloid on the back of my head for like 4 or 5 years. That's gone. So it's wonderful because if you keep patching, you're going to keep regenerating, and that grocery list of items, big or small, it starts to all go
right.
away.
And the thing you need to understand about patching and be educated about it is
Hmm.
that it's different for each individual, how it affects you.
Hmm.
When you might notice something, you may start patching for a given reason, but the patch does
Hmm.
other things in your body first because it's smart therapy,
Yeah.
it's smart
Smart tech.
technology.
Yeah.
It goes where the need is greatest, then
Hmm.
it works on that, then it goes to the next area. And so that's why some people get immediate results, some
Hmm.
don't get it for a while. Most people, 3 to 6 weeks,
That's what the clinicals
they
show.
will notice something
Hmm.
significant. What I've heard most often from people is
Hmm.
energy level improvement, general sense of well-being, sleeping better.
Yes.
Those are almost ubiquitous, almost
Hmm.
common with everyone.
Clearer thinking,
Clearer
and the
thinking.
wound healing. And people have gotten surgeries, they cannot believe that they're getting out of surgery and they're healing so quickly. They're not really in pain. Their doctors are amazed. They're like 40% ahead. Has been several reports we've heard from people on their therapy and recovery, and predicted to make a full recovery,
Yeah.
which is
And
exciting.
and you may be one of the blessed people who's a one patch or 1 week wonder, 1 day, 1 week of patching and just changes your life.
Right.
It's like a bell curve. There's a few people, a
Hmm.
percentage that happens. And then on the other side, there may be people who have to wear the patch for a month for every decade of life. I'm 68, so I've lived 6 decades. I'm living in my seventh. I need to wear this patch for 7 months before I make a decision on what it's happening. Now, it's rare it
Hmm.
would take that long, but so I would say don't give up, wear it consistently, 12 hours on, 12 hours off, give your body a chance to take care of what it needs to get to the point where it's the thing that you are using it for. Or maybe you just want to use it for anti-aging. The value is definitely there. And then the question always comes up, how long do I have to patch? Well, the patches were designed to be worn 1 month for every decade of life.
Yes.
What about when you're done with that? Are you done wearing the patch? Because I went past that seventh month in my seventh month, but I didn't quit wearing the patches.
No.
Now, you can quit wearing the patches after that point, but you'll go back to aging the way you did. You don't lose the gains you've gotten.
Hmm.
But I didn't want to, for the $3 a day of the X39, I didn't want to take that chance. So I've continued on that.
Or the $2 for Eon, because we usually wear those two together,
Well, one other
right?
thing that's important, I always start people when I start them on the X39 stem cell activating patch, which is what I start everyone on.
Hmm.
I always recommend they do it together with the supportive patch called Eon, AEON,
Hmm.
which is an anti-inflammatory patch. And that's extremely important, not only because inflammation is a cause or a promoter of every kind of disease, not
Hmm.
that it's a bad thing. If it's acute, it helps heal your body. But when it becomes chronic, long term, out of balance, too much, that's what causes and promotes diseases.
Right.
So it's a good enough reason to keep inflammation down just for that reason. But when you're activating stem cells, which you are, when you put X39 on, we can clinically
Mhm.
prove that you are going to wake up those stem cells. Then stem cells are attracted to where the action is in your body. And the action is where the inflammation is. And everybody has inflammation. The
Yeah.
older you are, the more you have, and the more medical issues you have, the
Mhm.
more inflammation you have. So when you wake up stem cells, some of them will be used up dealing with the inflammation. So if you keep the inflammation in balance with the Eon patch,
Mhm.
you'll get quicker and better results. So no matter what question you ask me and what should I start with, I'm going to start with those two patches. There's many other supportive patches that are
Right.
wonderful
Mhm.
and important to use, but to start with, the X39 and the Eon, and eventually, if you wore those long enough, they could do everything that every other patch could do, but it might take a long time.
Mhm.
And let's face it, we don't want to wait too long. If we can get it done quicker, we want to get it done quicker. So that's
Absolutely.
where we start with most people.
Absolutely. Well, it's a night of Q&A. We've asked you to put your questions in the chat, so we'll take a look at a few of these. Again, we can't really talk disease and sickness, but let's see what you guys have going on. Someone had a heart attack 9 years ago, would like to get off their heart attack medication. I know what you're going to tell them they have to do. Ask
Yeah,
their doctor,
you have to
first of
ask your
all.
doctor, but the
Yeah.
beautiful thing about this is that in no way is a deterrent to using patches. You can be on 10 medications and use patches because it's non-transdermal, and there's very few things out there that are like that. So
Hmm.
start patching for sure. Now, I would take note of that clinical study Susan already made reference to, and I did
Hmm.
too.
Hmm.
6 weeks of X39 patching de-ages your cardiovascular system by 8 weeks.
Wow.
Wow. I'd
That's
be getting
exciting.
on that. And then you've got inflammation if you've had a heart attack and you
Hmm.
want to get quicker and better results. So X39 and Eon
Hmm.
consistently, and eventually you can possibly get off one or all of those drugs, which you're going to have to work with your doctor on that. But it's definitely a better approach. I mean,
Hmm.
we are addressing the cause of the problem. Where pharmaceuticals are really good at covering symptoms, but they usually ignore the cause, many times make the cause worse. So it's a
Right.
short-term uh, asset, but a long-term liability. Why
Hmm.
not do something that's going to correct the problem, which is what patching is designed to
Right.
do, and letting your own body do the work.
Sure. Paulette is asking if there's any stories about improvement in kidney function. We have a wonderful app. You might be a member. I hope you are, that you have downloaded this, called Telegram. And we have over now 3,000 testimonials that you can search. So please ask the person who invited you tonight to get you hooked up with our Evolve stories, before and afters, and you can look those up, because we have so many wonderful, wonderful testimonials.
Yeah, well,
Um,
guess what? Stem cells can become kidney cells. So
right,
even if you have limited kidney function, if you can wake up some stem cells, we can remake some kidney cells. And kidneys are notorious for growing, for expanding in size. You can remove one of your kidneys, and the other
mhm,
one grows to twice as big and does the job. So
right.
kidneys are set up for that, but you may need some stem cell activation to get that
Hmm.
process. Well,
Donna, inadvertently, and thank you for those of you who are answering some questions too. She wore her patch a little too long, and she's wondering how long she should wait before wearing another
yeah,
patch.
she wore it, says 18 to 24 hours.
Hmm.
How long should she wait to wear another one? It doesn't matter. You could the very next day put your patch on right after you take the other one off. But I wouldn't do that for 2 days in a row because you don't want your body getting used to it. You could skip a day if you want to, but it's not necessary. It's not dangerous to wear the patches 24 hours a day. A couple people not knowing what they're doing have done that when they first started, but the body gets used to it potentially, so it won't be as effective long term. But 1 or 2
Right,
days making a mistake like that, not a big deal. Let's say you forget and you only wear it 10 hours. That's okay. It's better than none. Even
right.
wearing it 6 hours, you say, "Oh, I forgot. I'm 6 hours into my day." Put it on.
Absolutely. Very, very good. Our friend 72 had a stroke a week ago on the right side. Should he patch left side or right side?
Well, it doesn't matter. What I would recommend for that is the X39 for sure, stem cell activation, and you wear that at the midline, C7.
Mhm.
You don't have to get complicated about patch placement. I
Okay.
think you can. I always put the X39 on C7. It can also be worn an inch below the belly button. Clinicals were done there too with the X39. The
Mhm.
Eon, I usually recommend an inch below the belly button. It can
Mm.
also be worn at C7, but that's one that you could consider moving around the body if you have a point that's particularly troublesome,
Mhm.
a pain or something. You could try wearing the Eon in that position, but
Mhm.
patch placement's very simple usually, and there's several places you can wear it. It will work anywhere on the body, so don't get
Mhm.
confused or hung up on that. Just put your X39 on C7, your uh, Eon an inch below your belly button, and be consistent.
Very good. Yeah, that's important. My friend had a bad reaction with wearing the Eon. She placed it on C7. There was huge swollen plus a headache she never had. How could I explain to her?
Well, when that happens,
Mhm.
I get excited when that happens. You say that's strange. Well, that means we're having her body is really getting affected by this patch. There's something going on. Now, if it's an allergy, a skin allergy, about 1 out of 20,000 people are allergic to the adhesive. It's the same adhesive in Band-Aids. Then take it
Mhm.
off. You don't even have to put it on your skin. You can wear X39 in the collar of your shirt. You
Right.
can wear the Eon down in your shirt or in the inside of your pants.
Mhm.
If it's the back's peeled off and it's within an inch and a half of your body, it's working.
Right.
So you don't have to worry about that. But
The
when,
headache tells me
yeah,
she's got to drink water.
right.
Right.
That we call that a healing crisis. When someone says, tried patches and I can't wear them, they made me sick. No, they didn't. They
Mhm.
started moving things out of your body and changing things, and you interpreted that as the patch making you sick. The patch was trying to make you well. That usually only lasts 1 day or a couple days at most,
Right.
and your body will tolerate it. If you're concerned, you can skip a day, wear it every
Okay.
other day until you do that. The most common patch that happens with, I would say, is the glutathione, which is a great patch. But one of the big things it does is detoxification. And if
Yes.
you clean your body out too fast, you're pulling toxins out,
Yeah.
and you may get a headache, you may get
Mhm.
nauseated, fatigue, whatever.
Right.
Symptoms might be various, but
Mhm.
you can, for me, I would tough it out, just stay with it and get through it. You'll get through it quicker. But you can always wear it
Skip a
every other
day.
day,
Right.
and that'll
Right.
take it away. In rare cases, if you're super sensitive, you may
Mhm.
have to go 2 days off, 1 day on for a week.
Okay.
Then you
Very
can
good.
go to wearing it every day.
Beautiful. Okay, here's an interesting question. Can X39 activate adult cancer stem cell? I don't think there is such thing as a cancer stem cell, is
No,
it?
there's not a cancer stem cell.
Okay.
A cancer is when a cell loses its ability to stop duplicating. Your cells have a thing called contact inhibition where they feel other cells around them and they go, there's enough. We don't need to make any more.
Right.
A cancer cell loses that and cells start piling up. But that's not what makes it cancerous, because that can be a benign tumor if they just stay in that location.
Okay.
What makes a cancerous tumor
Mhm.
is when it has the ability to break away from that primary site, thing called metastasis, go to another area and set up shop there and eventually displace that function, whether it be the bone marrow, the brain, the liver, and displace that function. That's what causes the problem in cancer.
Okay.
So when you patch, how does that all work there? Well,
Mhm.
certainly we're not saying patches cure or treat cancer. However, patches are very powerful immune modulators. One of the cells of your immune system called a T4 killer cell, whose
Mhm.
job is literally to go around and find cells that have lost contact inhibition, abnormal growing cells, and eat them up.
Mhm.
So a stem cell can become that. So we certainly support the immune system, your own immune system ability to fight cancer, which by the way is happening in every one of us right now.
Yes.
Even if we haven't been diagnosed with cancer, you have
Mhm.
100 trillion cells, and about 2,000 of them go haywire a day, but they start to grow uncontrollably. But your body recognizes it, eats it up, keeps it in check.
Mhm.
So then, when does someone get a diagnosis of cancer? When their body isn't keeping up, whether it might be they're toxic, they're stressed, they're nutrient deficient,
Mhm.
whatever it may be. The immune system is not up to par, but by patching, we can restore that balance to the immune system and let the body
Heal
take
itself,
care of itself.
right?
It's the body that does the work to
Mhm.
fight abnormal growths.
I love it. All right, what about X39 helping thyroid
Well, thyroid tissue is
or a dead thyroid, they wrote?
it's a gland, and the thyroid makes
Mhm.
thyroid hormone, which is extremely important in metabolism, the rate at which you burn calories, and energy levels,
Mhm.
several other things in your body. And it's typical, especially women, as you get older, to have low thyroid. And part of the reason some ladies are just tired all the time,
Mhm.
and it can cause fat accumulation. Cold intolerance is very common with that.
Mm,
And so you go on a thyroid medicine, which is great to be able to have that so you don't have to suffer with those symptoms.
okay.
But you can wake up your thyroid by wearing the X39. You can help. And we've had many even
Had
personal
some
examples of this where people have had to
we have.
actually cut their thyroid medicine down.
With their doctors,
Yeah, their doctor's the one who did it. They
yeah,
measured the
so
thyroid and said, "You
called them
got
and
too
said,
much thyroid.
yeah,
What's
and
going
they
on
kept
here?"
putting it down and
Well, they
down.
woke up their thyroid.
Mhm.
One of which was actually had the thyroid removed due to cancer of the thyroid. But
Mhm.
you always retain some thyroid function, so we could potentially wake that up. So once again, X39,
Right?
and I would certainly add the Eon because there's inflammation involved there, and you're going to get quicker results with the two together.
Okay, somebody has some nerve damage because we're not naming diseases because we don't make any claims. But what about nerve damage,
Yeah,
Dr. Di? She said she wore X39 for about 9 months, and she wasn't really feeling any improvement.
okay. Well, nerves can take a long time. They grow at about the rate of 1 millimeter per month. So let's say you got numbness in the
Okay.
tip of your finger. It's got to go all the way from where that nerve cell body starts in your spine, 3 feet. And at the rate of a millimeter is very small amount.
It's going to take some time.
Right. So that's one that can take a lot of time.
Hmm.
But stem cells can become nerve cells. And there's other things the body can do to do it more quickly. I would definitely add the Eon to that. I would
Hmm.
still continue to do it, even
Yeah.
if you've done it 9 months. I got some of the greatest results I've received between month 9 and 12.
Hmm.
So that's something, just stay the course. It is doing you good, even if you haven't really noticed it.
Okay.
And
Well,
I've seen a lot of times where people wear it for some reason and they don't see any improvement, none, not a gradual improvement, no change. And then one day it is
boom.
gone.
Yep.
So don't be
Yep.
discouraged if you're not gradually getting better. I
Hmm.
don't know why. It takes
Hmm.
longer in some cases.
Hmm.
Whatever it is, the body sorts it out and does the work.
Well, and also, I don't think we mentioned, maybe we did earlier, but the genetic working on your genes,
Yeah,
on the
within
genome.
24 hours of putting on your very first X39 patch,
Hmm.
you'll be excited to know that it's communicating with 4,100 of your 18,000 genes, and
Hmm.
genes talk to each other. So very quickly, it's through the whole genome to tell them to express at a healthier, more youthful level.
Hmm.
So working even on the genetic level,
Right.
powerful modality.
What about the adrenal system? How do we support those?
Yeah, well,
What patches?
adrenal system, of course, a stem cell can become an
Hmm.
adrenal cell. So we're going to start with X39
Hmm.
and Eon. However, the adrenals are a gland, just
Okay.
like the thyroid. I was going to bring this up anyway because we
Hmm.
didn't mention it with thyroid. Glands like the thyroid, endocrine glands, the pancreas, for example.
Hmm.
There is a specific patch beyond the X39 and Eon that supports endocrine glands. It
Hmm.
supports all body organs, but specifically glands.
Okay.
So in the case of thyroid, it'd be for metabolism, the rate at which you burn calories and energy. Or adrenal glands, it would be
Hmm.
dealing with stress. If you're overstressed and you put out too much cortisol, that
Hmm.
causes toxic accumulation of belly fat. So you want to
Mm.
get some balance in that regard too, because
Hmm.
that can even lead to diabetes. And then finally, the pancreas itself, endocrine gland, which not only makes enzymes, food enzymes to digest your food so you can get the nutrients out of your food, but more importantly, makes insulin, and insulin helps your body to balance blood sugar, and it's your body doing that work. But
Mhm.
you support the pancreatic function, and then the body can support normal blood sugar levels.
Did you mention SP6?
That's SP6, that
Okay,
patch that feeds the endocrine glands, and
okay,
then also ovaries, testes, the hormonal balancing. SP6 has a function there too.
wonderful. What about ringing in the ears?
Well, it depends on what it's caused by, of course, but very
Okay,
common. But very common to exist and then go away too.
yeah,
So don't be
okay.
discouraged about that. Don't think because it's ringing now, it's going to ring the rest of your life. It's nerves. Obviously, it's something to do with the nerves. Is it
Mhm.
inner ear? Is it the outer ear where it's collecting the information? Is it middle ear where the hearing apparatus is transferred
Okay.
from the outer to the brain?
Mhm.
It doesn't matter as long as you activate those stem cells, the body will go to work on what's causing that,
Okay.
and you will definitely
What
experience
patches?
less of that. And there's inflammation involved in that too. So
Okay.
X39 and Eon for that.
Would you place them anywhere differently, like
Nope,
here,
I
or
would
would you put
not.
them
I
in
would just wear them at
the
the.
normal places? Okay. What about bone health? There's several questions here about bone health.
Well, you're gonna get bone support definitely with the
Mhm.
X39 and Eon. The bone
Mhm.
marrow is where the cells, the immune system are formed, for example, and you're
Right.
definitely gonna get immune support and balance with X39 and Eon. There is, however, one other stem cell activating patch called the X49, initially made for professional athletes.
Mhm.
What does it do? It's very good at building muscle, burning fat, great for stamina, staying power, but also bone health,
Mhm.
fighting the thinning of bones, which is called osteoporosis, helps your body to maintain uh, that bone. And of course, both the X49 and the X39 would support the osteoblast, which is laying down new bones, and also slow down the activity of osteoclasts, which is the bone breaking down cells.
Mhm.
So it's that balance that needs to stay in balance to help your bones get stronger. And when you have stronger bones, you have a stronger immune system. So I would go X39, Eon, and X49. And by the
Mhm.
way, when you wear X39 and X49 together, you also have the added protection equal to being in a Faraday cage, which is a protection against negative EMF, electromotive force, electronics, things like the
Mhm.
electricity in your house, your cell phone, cell towers, or
Mhm.
electric towers, giving you added protection.
Beautiful. We got a lot of testimonials here about blood pressure down 20 points. An 80-year-old lady, young lady, she fell down and fractured her tibia. She started on the X39 and is already feeling so much better. This is exciting to see all this. Are there any benefits to wearing two X39 at the same time?
There are benefits, however, they're not worth doing. You might get a
Hmm.
10% benefit by wearing the second one. It's
Okay.
just not cost effective. And more importantly, it's not necessary. More important, be consistent with
Hmm.
the X39 you wear every day. It's not dangerous. You could wear 5 X39s, but
Hmm.
it'd be expensive and it's a waste of money.
Okay.
Two, if you want to try it for a day or two, that's up to you. But really, just be consistent with one. You'll get the best results and the best value for sure.
Interesting. What do you think about the benefits of, it says, please explain how the patch benefits athletes and professional athletes using them.
Well, professional athletes want several things. First of all, they want to maintain lean muscle mass.
Hmm.
And that's what X49, top of the list, that's what it does. They also want to keep fat at a minimum. They want their body fat levels extremely low.
Hmm.
And X49 also does that. And they want strong bones.
Right.
And that's X49 hits on all of those cylinders, along with giving you stamina and staying power, which is
Right.
extremely important for athletes as
What
well.
patches would help a person who has a spinal injury causing paralysis in the legs?
Well, you want rejuvenation of nerve cells there, and there's
Hmm.
really nothing I know of quite like this modality and being able to do that because you can make new cells in the nerves. That's where stem cell therapy originally was being used and still is being used in spinal injuries and
Right.
knees and hips and backs.
Okay.
But this is a way for your own body to do it, and it systemically works all through your body.
Right. If someone is up, they jumped away from me here. If someone had brain surgeries to remove the pineal gland and also the thyroid, how does it work if the glands are gone?
Well, here's how it works. You never get all of the tissue out.
Okay.
And so with thyroid, you may think you got it all, but you're going to still have some function. So you still have hope there. Pineal gland, I don't know of pineal tissue occurring in other parts of the body, but there's other brain centers that work on the wake sleep cycle that
Hmm.
will take over for that function. But my speculation is you may have some residual pineal function as well that
Hmm.
can be restored and rejuvenated. You don't know, but you don't need to know. What you need to do is wear the X39 consistently, keep the
Right.
inflammation down with the Eon, let the body do the work.
They had somebody suffering from black mold poisoning. What patches?
Well, I'm going to say very important here now to add to the X39 and EN, which I'm always going to start with, is for sure, the glutathione. That's our detox patch. It supports the liver function and kidneys as well, and colon, all the organs of detoxification, and the lungs, which and the skin, which are all organs of detoxification.
Right.
But specifically, it's going to help you fight those toxic situations like with a black mold. You need immune
Hmm.
balance for the X39 and the Eon, but you also need some of the detox pathways, the SOD, superoxide dismutase pathway, which is what glutathione supports.
Okay.
It's what helps you handle the 5,000 toxic chemicals that every one of us faces in the food we eat, air we breathe, and water we drink every day.
Hmm.
Glutathione's not a bad choice for a third patch to wear, and you could wear it every other day.
Right. Because our glutathione patch is really powerful. Can you explain how it works for everyone?
Well, this is a true paradigm shift, and this is sort of my
Hmm.
wheelhouse. When I would use glutathione before in a formulation,
Hmm.
the dosage of orally of glutathione might be 500 milligrams, but the half life of glutathione is only 7.5 minutes. That means 7.5 minutes after I give someone 500 milligrams of glutathione, it's down to 250 milligrams. 7.5 minutes later, 15 minutes in, it's down to 125, and so on and so forth. Within 2 hours, there's no glutathione left. And that's whether you give it IV or orally.
That's
Now, the
something.
patch is shown to increase your own production of glutathione by your own liver,
Hmm.
and you can make up to 300%, three times as much, and the benefit lasts for 24 hours. So if you're
Hmm.
wearing it 12 on, 12 off, you're getting consistent 300% increase in
Hmm.
glutathione levels. That's a paradigm shift. No doctor or clinician can come close to giving you that kind of protection against aging and free radical damage
Hmm.
that you're getting from this patch.
That's pretty exciting. Any suggestion for patches for a toothache and infection and where to place it?
Well, infection's loaded with inflammation, so we're going to make
Hmm.
sure we're using our Eon there. And I would put the Eon just in the area of where the tooth is.
Hmm.
Doesn't have to be inside your mouth. It can be right
Right.
outside because
Right
it's
on here.
within an inch. It's not
Right.
your skin on your face is not more than an inch and a half thick. So it's exactly like putting it right on the tooth.
Okay.
Put the Eon there, but wear the X39 as well.
Okay, beautiful. I know we've had our son one time come in the house. It wasn't a toothache, but really terribly tight muscle, and we popped it. He said, "I got to get to the chiropractor." I'm like, "It's Saturday; they're closed." But here, how about an Eon patch? And so we popped one on the back, and he came downstairs about 10 minutes later. He's like, "This is great. This is weird. It's gone. It's like all loosened up and gone," which was exciting.
Yeah, let me mention this also. Let's talk about Icewave quickly, which is a
Yes.
unique patch
Hmm.
because not only is it a two-patch system, which means when you get a sleeve of it, there's 30 patches in a sleeve with all of our patches, but this is only 15 days worth because it takes two patches to work. It it affects the signaling of pain in your body. So it's a patch that's not as concentrating on the cause of the pain, but
Mhm.
interrupting the signal. So how you do it is you take the tan patch or the brown patch, put it right on the pain as close as you can get.
Mhm.
Then white patch, white on right. You
Yes.
go to the right of it, a couple inches, wherever it may be, and peel off half the back and hold it there for maybe 10 seconds and ask the person, do you feel any difference in the pain? If they don't feel anything, move it, circle around, and wherever else on the body you move it to, hold it for 10 seconds, don't leave it there, and
Mhm.
just get an assessment. And if you do get to a point where it's lowering the pain, then you peel the other half of the back off, stick it there and wear it for 12 hours.
Mhm.
That's the ice wave. And that's not as much addressing the cause of the problem like the other patches,
Mhm.
but the advantage is it acts immediately. And this is an attention getter. If someone's got pain in
Oh,
their
yeah.
body, you keep an ice wave with you because they get impressed when they go, how did you do that? Well, you
Mhm.
didn't, but
Right.
these signaling from the patches did it.
Exactly. As a nutritionist, what would you recommend for weight loss? X49 or SP6? Do you have to choose one?
No, you don't have to choose one. I guess if you want to muscle build at the same time, I'd go with the X49.
Mhm.
And SP6, if you think your metabolism's slow, low thyroid, you've got a lot of stress, you got blood sugar issues, all of which are going to cause weight gain.
Mhm.
Yeah, SP6 would be a choice. However, you may get you get muscle building and
Mhm.
fat loss just with X39 and Eon. So you could start and do a month of that, and then you can always add the SP6
Mhm.
or the X49, and there's nothing wrong with using all four together. And you might say to me, well, why don't I just start with all four? Go right ahead.
You can.
It's basically a financial decision, and it's
Right.
not a huge financial decision. I mean, for another $5 a day, you can wear the X49 and the
Mhm.
SP6. Start with the whole shooting match. That's up to you how quickly you want to get results.
And you always tell people if you're concerned about spending the money fast one meal, that will help you lose weight as well. And it's actually a very good healing modality is fasting. And so often we just don't do that anymore. But it helps everything. It helps the body work better and drinking water and it just gets things moving, correct?
It does indeed. I love
Awesome.
the Matthew 6 in the Bible where it says, when you give, and you should give. And it
Hmm.
says, when you pray, and you should pray. And it says, when you fast,
Yes.
and you should
And you should
fast,
fast.
not if you
Uh,
fast. And you don't have fasting doesn't mean you don't eat. You can fast your favorite junk food. I recommend you
yes.
start that fast tomorrow.
Right. There you go. What about regenerating discs?
Discs have something in them called a nucleus pulposus, which is a jelly-like material that gives the disc its cushion. And
Okay.
that's its function. It's like a spring between the bones in your back because they're constantly having to move and take
Moving.
the
Sure.
brunt of this up and down force. So those are made by cells,
Hmm.
and there's a cell lining that nucleus pulposus, and stem cells can aid in that process. So
Right.
we're going to want X49, 39 for sure there, but there's lots of inflammation when you're dealing with that. So make sure you use your Eon
Mhm.
at the same time.
Somebody wrote, carnosine and glutathione helped improve my vision. Wore for 18 months at night. The DMV did not want to reissue my driver's license today. I can thread a needle without glasses.
Wow, that's
That's so
great. Yeah,
exciting.
I'm glad you brought that up and shared with us because I haven't talked about the carnosine patch.
Hmm.
That patch, I tell people, if you have a brain or a heart, you can support it with carnosine. Carnosine is
Right.
very good. It's good support for all organ systems, but particularly the heart, the brain. That's a wonderful patch. The way
Hmm.
I do it, I wear X39 and Eon every day, but I
Hmm.
wear glutathione and carnosine every other day. If I'm wearing my carnosine, I'm not wearing my glutathione. If I'm wearing my glutathione, I'm not wearing my carnosine.
Sure. Bob Campbell, our friend, has weighed in and said all four of my son's herniated discs in his lower back have healed. His doctor cannot believe it. He was astounded. It took 2 years for them to hear using X39 only. Doctor said he has never seen this in his practice, and he is in his
Wow,
60s.
thank you, Bob, and thank you for your great testimony. I tell your story all the time. I wish we
Hmm.
could pop you on and tell. It's one of my favorite stories
Yes.
because it took many months for you to get to the point where it took care of a severe pain problem that you'd had for many years, although the
With feet,
X39
right?
did
Knees and
many other
feet.
things along the way. And you're the encouragement to stay with the program, that
Mhm.
educational piece of teaching people the value of consistency when using the patch. So we appreciate that. We're
Mhm.
happy for your son. And once again, you're a great example of the X39
Give it up.
used long enough can do
Mhm.
everything all the other patches can do. So you might say to me, well, then why don't I just use X39? Why don't you? Well, it could take longer, but if you use it consistently, you're going to get
Right.
those benefits. Everybody should be using X39.
That is like the foundation of your home, and then we bring in the Eon with everybody. We start with those 2, right, honey? Okay, what patches do you recommend for to best support kidney function, please?
Kidneys are the organ of detoxification. They, of course, strain the blood, cleanse the blood,
Mhm.
and make urine. And kidney cells are like any other cells in your body. They can be made from stem cells. So I'm going to start with X39. If you're having issues in the kidneys, you have inflammation for sure. So using the Eon at the same time will save you time. And I
Okay.
think ultimately down the road, money. So I would start with those two.
Okay. Somebody has had severe head pain from a concussion. Which pain is recommended for relief, or which
Okay,
patch? I'm
before I say
sorry.
that, let me go back to kidneys a minute.
Okay.
Glutathione, I'm going to add there, just because anytime you're supporting a major organ of detoxification, which is liver number one, probably kidney number two, colon number
Mm-hmm.
three, although some people think colon's number one, hard to argue with, and
Right.
even
Right.
fat. Fat is where toxins hide in your body. You want to start with detox. So
Okay.
don't forget the glutathione. And then as far as concussion goes, I'm always going to start with the X39 and Eon, and you've got inflammation, so you need that for sure with a concussion. Concussion just means you had a brain injury or a head injury that
Hmm.
resulted in a change in consciousness.
Okay.
And it may or may not be a specific brain injury there, but you want to support that with X39 and the Eon, and then carnosine as well, because carnosine is like food for your brain.
Okay. Um, Someone has had severe poisoning, heavy metal poisoning, and she cannot tolerate X39 even for an hour. It's just way too
Yeah.
stimulating. So is there a connection?
There may be, but I would still want to find a way, even if it takes you a week or a month to be able to wear an X39 the whole day, get it on eventually. But in this case, let's go to glutathione.
Okay.
Let's let glutathione start this heavy metal detoxification, support the body's ability to remove heavy metals, which is exactly what it does.
Okay.
Some of those pathways in the liver, especially,
Hmm.
are stimulated there. So glutathione, there's lots of inflammation in that process. Glutathione and Eon, you can
Hmm.
skip the X39
For now,
for a
if he
while.
needs to.
Yeah,
Yeah.
do that for a month and then start slowly introducing the X39. But eventually your goal is to be wearing X39 every day,
Hmm.
because remember, by the time you're 35, you've lost half of your stem cell activity. By the time you're
Yeah.
65, you've lost 90%. Let's turn back the hands of time. Let's wake up those stem cells,
Right.
which can help with whatever's going wrong in your body.
Let's talk about prostate health.
Okay, prostate health. Here's the thing with prostate. A prostate is a gland. It's like a
Mhm.
donut that goes around the tube that goes from the bladder out of the body, which men the urethra.
Okay.
That tube is the tube which urine goes through. Well, because it's got a very tough capsule around it, like all the rest of your body, continued cell growth, when you get to be more mature aged, you're making more prostate cells and they can't expand the prostate. So they expand, so to speak, in and pinch off that flow through the urethra. So
Okay.
most modalities are targeting that. I mean, when you get your prostate removed, that's what you're doing. You get it out of there, then you can have problems with things like incontinence where you can't hold your urine back or other things. But uh, there is inflammation involved, and anytime you got a prostate issue, especially if it's prostatitis, it's caused by inflammation. So Eon for sure. Of course, the X39, because it can feed the prostate directly with new
Hmm.
prostate cells and balancing the growth there. Personally, I've just had a lot of people report to me with using the X39 and Eon has affected their PSA level, prostate
Mhm.
specific antigen, which is really unheard of to be able to improve that level. So we're getting reports like that.
Okay, that's so exciting. What about kidneys? Somebody dealing with dialysis 3 times a week.
Yeah, it's a detoxification organ, so we're going to want glutathione there,
Okay.
but the foundation is X39 and Eon.
Okay, beautiful. Got about 4 minutes left. Normalizing blood pressure.
Blood pressure, of course, is there could be a number of causes for it.
Okay.
Your blood pressure goes up when you get excited. Your blood pressure goes up when you exercise. That's normal. But if your resting blood pressure is too high, and it's the lower number that's more important, the
Hmm.
diastolic,
Okay.
the higher number is really affected by emotion. Sometimes people go to the doctor, they call it white coat
Okay.
hypertension. You get around the doctor and that pressure goes up. But usually,
Hmm.
blood, high blood pressure, what is it caused by? It can be caused by many things. I'd say most often it is the condition of the inner lining of blood vessels, arteries in this case.
Okay.
Usually, arteries are elastic and they have the ability to expand.
Hmm.
When they get hardened, hardening of the arteries, it's like pressure in a lead pipe is much higher than in a rubber hose that has the
Mm,
ability to expand. So
sure.
that causes blood pressure to go up. So you want to limit that free radical damage that's causing
Hmm.
the high hardening of the arteries. How do you
Okay.
do that? Well, detoxification is important. I think glutathione would be important there, but X39 and Eon, there's inflammation.
Okay.
When there's an injury, it's specific in antioxidants uh, lack that causes that injury, which
Hmm.
glutathione is the restorer of antioxidants. Eon is the quencher of the inflammatory process that's involved there. So for sure, those two, and I want to get new cells lining my blood vessel, which is the X39. The
Right.
next one I would go to on that would be carnosine.
Right. Tell me 3 things about carnosine.
It's good for your brain, it's good for your heart, and it's good for your immune system.
Acid reflux and heartburn.
Acid reflux,
That's going to be our last one.
all right, acid reflux is really misunderstood and mistreated in traditional medicine. You need acid in your stomach to
Hmm.
digest foods, to get minerals. You can't even absorb calcium and magnesium properly without good acid content in your stomach.
Hmm.
GERDs, gastroesophageal reflux disease, or heartburns, got nothing to do with the heart. It means your lower esophageal sphincter, the round muscle that's where your esophagus goes into your stomach, is weak. It's not working right, and it's allowing some of the stomach acid to creep up into the esophagus. That's what causes that heartburn. So
Okay.
we want to balance and strengthen that muscle. How do you do that? Well, there's no exercise you can do for that. You can, after you eat, don't lay down flat. Stay elevated.
Okay.
Sometimes people do better when they sleep on a couple pillows or elevate the top of their bed.
Okay.
And then there's certain foods that can trigger it that you want to avoid, of course. But X39 and Eon, there's inflammation there. So you want to keep inflammation down, and X39 can help strengthen that muscle. So I would start with those.
Okay. Beautiful. Up. God bless you. So wonderful. Thank you so much, you guys. We have had a wonderful time with you tonight. There has been a ton of information. I know this is recorded, so you'll be able to see this and look at this again, and hopefully even read back on some of the comments, because there has been so many testimonials going all night while you've been talking. So it's really been great. Thank you again for joining us. Dr. Stacy will be back with you next week. She is currently in London, having a wonderful time with the teams in London, along with Laura Balzer. And I believe, who else is with them? They've got a few people, April Vaughn. So anyhow, we just appreciate you. We're so thrilled to be on this adventure with you. It has been an amazing time together tonight. We hope that this has helped you, and we wish you a wonderful, wonderful evening. God bless you all, and good night.
Good night.
Bye-bye.